Reported at the beginning of the year on one woman's battle to get proper treatment for her daughter, who is treated for anorexia by 7 different teams across the country. Rachel Bannister had written an open letter to the Health Secretary, Jeremy Hunt, about her daughter's plight the previous November. She and her daughter then talked to Mr Hunt, but they found his response alarming. One of the points she raised was that despite her daughter being found a place at a specialist unit, it was a long way from their home in Nottingham.
Back in 2016, she was not long out of a hospital in Nottingham. It wasn't a specialist unit. They didn't have the staffing and the skills there to treat her. So she came out actually quite vulnerable, not at a good weight, not eating a very good diet, and went downhill quite quickly. And it was just the usual scenario that happens every time she needs more care. Outpatient services don't have that in our area. There isn't a step-up service. And a hospital becomes inevitable. And unfortunately, the only place they had for her that could deal with her complexities was the specialist unit in Edinburgh, in Scotland. And you can imagine what we felt like when that was suggested to us. It's not just for me, her being that far away, and the rest of our family, it affected all of us. My middle daughter then became so anxious about her sister, she stopped going to school, and that's an ongoing problem. And there is no provision made when your daughter's in that situation. Nobody's there to book the flight for you to talk you through how you do it. You're just told there's the bed and get on with it.
That was Rachel talking to me in January, and she's with me in the studio now. Good afternoon.
Good afternoon.
The most important question, how are both your daughters?
Well, as I heard in the clip there, my middle daughter is still struggling. She's not in school. We've had very little support really, so we're homeschooling her in her GCSE year. But she's doing all right. We're a strong family, and her sister's back home. That's obviously the most positive and the most important thing. And my elder daughter, the daughter that was sent to Scotland most recently, for the first time in the past 5 years, she's actually had continuity of care. Now we've achieved this by meeting with the CCG and
just explain who the CCG.
The Clinical Commissioning Group, Nottingham City Clinical Commissioning Group, and they did agree to pay through a personal health budget for some therapy, which is dealing with a trauma. Now, this is trauma that's come about that has impacted her broadly to do with her fragmented care that she's been sent to 3 different places. She's had 7 different teams look after her. Some of that being sent that far away from home, and at a young age, it has caused trauma. So I am absolutely convinced that for the first time she has got continuity. She's got a wonderful therapist who uses Parks and a Child's therapy as well as other skills that she has, and she's had that continuity virtually since she came out of Scotland. We paid for it privately initially, but now that the CCG have agreed to pay for that.
So what you described then back in January as an appalling situation has got better. Do you think it's got better overall?
No, it hasn't. It just hasn't got better overall. I mean, the amount of families, the young people, the mothers that I've met throughout this journey and through social media, it's getting worse, and it's got worse. It's getting worse, but it's been deteriorating, I think, over the past 5 years since, I'm afraid, Jeremy Hunt, since you've been Health Secretary, it's happened on your watch. I was at a meeting at the Royal College of Psychiatrists this week. I'm a carer rep for the EC for the Trent region. I'm very grateful to have that position. And I sat there on Wednesday this week and I heard about redundancies that are going to happen in Nottingham. I heard about 4 to 6 million having to be cut from the budgets. I read a Children's Commissioner's report via Twitter a couple of weeks ago that lists the spending in CAMS, in the Children and Adolescent Mental Health Services, the amount they spend, 0.66% Nottingham CCG spend on our young people and their mental health. How can anybody... How can you, Jeremy Hunt, in your position, sit there, meet with me, hear these stories at first hand, and not do anything, not act? As far as I'm concerned, where there's a will, there's a way.
Well, can I just say, because we asked for an interview with Jeremy Hunt, given your criticisms, we got a statement. He wouldn't give us one. But they've issued a statement. He said that he was incredibly moved by your story. Everyone with an eating disorder deserves access to timely treatment. It's encouraging to see an increase in patients getting that. Inpatient treatment should be a last resort. What do you think of those sort of comments?
Well, he's very fond of saying that the waiting times have been reduced and patients are going to be seen. So first of all, being seen does not equate to being treated. If you look at what I describe as the mental health toolbox that Nottinghamshire CAMHS have had, it's virtually empty. We've got CBT, we've got family-based therapy, some of that's really good. We've got a consultant psychiatrist that's got hundreds of other patients on her books. There is no access to trauma therapy. We're trying to get some trauma therapy for my middle daughter who's suffered, through all this we've gone through, and she's just on a waiting list, and we're waiting, and we're in the system, and I'm able to articulate my concerns and to do all this.
It's something we've covered a fair amount on this programme. There is big problems with access to mental health for young people.
There is, and Jeremy Hunt's rhetoric, his spiel that he comes out with is, okay, all patients are going to get seen quicker, but they're not being treated because there aren't the staffing, there aren't the resources, and our own area, Nottingham, is going to be facing cuts. So I asked you, Jeremy Hunt, for another meeting if I wasn't satisfied. I've asked you for a position on your health board as somebody with lived experience. You chose to not answer either of those questions in the response you gave to me, and it's just not good enough. And I'm not writing to you again because it takes several months for you to get back to me. So I'm asking you now on Radio 4, please offer me a place on your health board so I can offer my insight and my experience, and we can get this crisis sorted out. When my daughter came out of Scotland, she was suicidal, and services could not do anything. They wanted to, but they couldn't because they didn't have the staffing and the resources to do that. So I had to do that, and I kept her alive, and we fought, and we've got the therapy that she needs. But what about people that aren't like me, that aren't lucky enough to have a strong family, to be resourced, to be able to articulate my concerns? What about them? And that's why my fight will continue. I've invited you, Jeremy Hunt, to come to our conference at Nottingham University on the 19th of May. Unfortunately, you said that you're otherwise engaged, so please make a video presentation that we can show to the people that are going to be at that conference. John Ashworth's done that, so I'm opening that up to you now.
Rachel Bannister, thank you very much indeed. And we did ask, as I say, for an interview with the Health Secretary, and he declined.